Hello there, and welcome to this Health Foundation seminar. What does the pandemic mean for the nation's health and health inequalities? Amazingly, we're joined by more than 2,000 of you, and we are really delighted that so many of you have expressed an interest in this topic, not least because it's absolutely boiling, particularly if you live in the southeast of London. So well done, and hope you can stay the course with us. My name is Jennifer Dixon. I'm the Chief Executive at the Health Foundation, and I'm going to be chairing the session today. So in this webinar, what we're going to be doing is sharing our learning so far on what has happened in the pandemic and focusing particularly on groups who've been particularly affected, such as young people, minority ethnic groups, and those on low income. Obviously, there's been masses that's been written and researched on this topic, and some of which has been regularly updated at the Health Foundation, which we'll continue to do and put out, as many others have done. But it's very important to take some time, we believe, to digest some of this material, talk to people who have different perspectives on it, and to chew the cud with you in the Q&A that we'll do at the end of the webinar. So we're really pleased today to be joined by four really excellent guests who will be each talking about the effect of the pandemic, looking through their own particular lens from where they're sitting. First of all, joining us today is Evie Bash. Evie is an illustrator, activist and campaigner whose work focuses on young people's mental health rights and LGBTQ+ rights and equalities. Evie, we're lucky to say Evie has been working with the Health Foundation closely over the last few years as part of our Young People's Future Health Inquiry. For those of you interested, that's available on our website. And Evie is joining us today to share how the pandemic has affected them and their peers. We're also very pleased to be joined by Muna Abdel Aziz, who is the Director of Public Health at Salford City Council. So Muna will be talking about the disproportionate impact of the pandemic on Black and ethnic minority ethnic groups and how that has played out locally in Salford. I'd also like to extend a big warm welcome to Mike Brewer. Mike is the Deputy Chief Executive and Chief Economist at the Resolution Foundation, who many of you may be following. And I have to say, you must have a look at their website. They have been producing some fabulous analysis during this pandemic, which is incredibly important. So Mike will be speaking us specifically about the economic impact of the pandemic and the implications of that for the nation's health. And finally, we have our very own Tim Elwell-Sutton, who is the Assistant Director on the Healthy Lives programme here at the Health Foundation. And Tim will be talking more broadly about the impacts of the pandemic on the nation's health and health inequalities, sharing what we've learned so far. So what we're going to do is run through each of our guests and have one talk after the other, straight after each other. And then what we're going to do at the end is have a Q&A session during which we'll tackle a selection of your questions. So some of you have already submitted a question, so thanks very much. And for those of you who haven't done so yet, so just chat and put in the chat box any questions you have as we go through the presentations that you might want answers to, and we'll try and get to as many as we can before the end at 1:45. If you have any technical issues throughout the webinar, always possible, please use the box on the screen, the chat box, to submit questions about that to our troubleshooting team who are on help and hopefully can help you out. And for those of you wanting to join the conversation on Twitter, please do so, and we'll be using the hashtag THF inequalities, hashtag THF inequalities. So before we hear from our speakers today, what we wanted to do is start by sharing a video of some experiences of young people. It's often the case with webinars like this, particularly in think tank world, to look and go straight to the data, particularly national aggregated data. But obviously experiences and testimony on the ground is incredibly important. So we asked Leaders Unlocked to develop a video with us, which they have done. We asked 6 young people to share their experiences of the pandemic so far, their concerns for the future, and their thoughts about what could be done to support young people. So what we're going to do first is just watch that video, and then I'll turn to Evie for a response. So perhaps we can now have the video. Thank you.
The pandemic has probably affected my life mostly in terms of education and my job.
Before lockdown, I was at university. I was in my last term and I had like a lot of work going on, but then it all kind of stopped.
I think it's going to be a struggle next year with trying to learn new things without being able to speak to my tutors in person.
Everything sort of moved online. Obviously no one was expecting to have to happen, so it all kind of seemed a bit thrown together. So that transition was kind of hard to continue learning and trying to make it work for myself.
The coronavirus pandemic has certainly affected young people severely. Specifically, I think, working class and the black and ethnic minority young people, whose statistics shows communities are more likely to be hardest hit.
We're more likely to kind of work in hospitality, retail, and those are the sectors where jobs are being cut or lost. I had been working part-time, but my contract had come to an end in February, so before, but then I thought I'll work full-time over the summer. So I had a job lined up and it kind of fell through because of the pandemic and stuff.
I've seen friends who graduated this year and had graduate jobs lined up, and then they've been told that unfortunately they won't be able to start the job.
One of the other main concerns that I'm so worried about is actually the fallout in terms of mental health for this, because over the next 2 years, potentially you could see a massive mental health spike across the UK.
More than anything, the fact that you're at home, you don't have that social interaction, your routine has just been completely and utterly disrupted.
Because of my role as a young carer, we have been more isolated. Family and friends automatically take a step back because they understand that the person you care for are vulnerable.
I've been shielding, so we've still more or less been living in a lockdown until the end of this week. So we've had about 4 months of sort of lockdown in a way, and that's had like a massive impact in sort of adjusting, and actually with that then comes sort of other issues of sort of mental health and anxiety of actually how do you integrate back into the world.
There's probably plenty of people that probably really struggled by not having anyone to talk to.
As someone who has suffered with anxiety and depression, being isolated and having the constant 24/7 news has been deeply troubling and has led to me being at crisis point a couple of times.
I found it difficult to balance my work and my free time, so usually I spent a few days just working non-stop, which isn't good for my health really. I think what the government could be doing for young people is just to create long-term jobs really.
Their Kickstarter programme is just a drop in the ocean. Their traineeships are numbers that are tiny compared to the amount of young people that are going to need help. As a young carer, they haven't announced anything that will help me get into the world of work or into education. There are entire sectors that are on the precipice of collapse. Young people in those sectors are going to need real support, not only to move to a different sector, but to retrain, to skill up. And so far the government plans don't seem to recognise just how difficult that is.
We all need to think about each other, because I think if we want a better future, it is about working together and getting through this and make things right.
I think what worries me most about the future is how uncertain it all is when it comes to jobs. If part-time jobs kind of in retail or hospitality are going to be available, and then in the long term nobody really knows how it's going to affect graduate jobs and if realistically you're going to be able to support yourself.
I'm at a stage where I've got to start planning for the future, and it is really difficult to think about. Like I don't know where I'm going.
Any private sector industry is going to struggle after this pandemic. Many people will experience what I went through with sanctions and universal credit, and it will create a lot of anger and resentment.
There is always going to be this year where they're going to be like, I paid like a full year, but I'm not getting the experience that I'm supposed to get.
We're heading for a crisis of youth unemployment, with millions of young people unable to find work and unable to secure long-term employment.
I'm trying to apply for internships and look for work experience and kind of get my foot in the door. But right now everything's shut.
It is very scary because this is the last thing that we expected to happen, and I guess things aren't ever going to be the same ever again. And in a way, that's good because it's made us realise that we need more flexible ways of working, and how things were working before probably wasn't the best.
That's going to be a gap, and that's still not really clear from what I've heard from young people, how they're going to get the grades, if they're going to get opportunities to resit, etc. They're just going to get grades given. Some of that stuff is still a bit unclear. And actually then there's a gap in their sort of like life in a way, and in their career prospects. It will have a knock-on effect.
So clearly some very powerful reflections there, and messages for the government. And anyone, I think, living with a young person at the moment can sense the anxiety and trepidation that they are facing and experiencing. So let me turn now to Evie. Evie, video was very powerful, wasn't it? In your experience and more generally, how do you think COVID-19 has impacted young people's mental health and well-being?
Thank you. Yeah, it was a really brilliant video. I think it really highlighted some of the common things that young people are experiencing, especially around kind of anxiety around housing and jobs and just the future in general, and missing out on those experiences that I think a lot of other generations have taken for granted, really. So before I start, I want to make it clear that I'm not pretending to talk for all young people. I think it's really important to remember that all young people will have a different experience. And yeah, depending on kind of like your culture and background and where you live and your home situation, it will be really different for everyone. So I want to talk a little bit about the kind of overall impact that the pandemic has had on young people's well-being. I think it's been quite a difficult time for people to find support. A lot of services that kind of specialist mental health services and also youth services have made the switch online, which in some ways is absolutely incredible. But I also think that it's missing out a lot of young people, and actually using technology and switching online is a big barrier for many. I think professionals sometimes forget that not all young people have access to technology, especially internet and Wi-Fi. It's incredibly expensive, and it's quite often those spaces like youth clubs and schools and universities, which is where young people can go to actually access the internet. And seeing as those places are shut, that kind of creates that extra barrier to work around. Obviously, this is going to create an increased isolation, and it's probably those young people who don't have access to technology or a smartphone who are going to be the most isolated and might need that extra support at the moment. And there hasn't really been a solution as yet as to reaching those people. I think I also wanted to briefly mention how it's impacted young people who have pre-existing mental health problems. I think for myself and certainly a lot of my peers, it's kind of felt like a bit of a step back. A lot of services, especially mental health services, have either just kind of dropped you as a client or haven't been in contact, and haven't really offered any support since March. And if you kind of rely on services and routine for your well-being, it's been quite difficult to make that sudden switch. It can feel like you're taking a few steps backwards, and actually those services that are keeping you going haven't all made the effort to keep in contact. Of course, that's not true for all services. There's some brilliant local ones in Bristol that have kind of gone above and beyond to ensure that they're still engaging young people and still keeping that contact. So, as I mentioned before, I don't want to pretend to talk for all young people, but a community that I would like to mention is young LGBTQ plus people. I think it's definitely a community that have been left out of a lot recently, and it isn't a new thing that LGBTQ plus people are kind of left out of specific plans and actions, but I think it's become a lot more highlighted, that it's definitely a community that gets left behind almost. I think in terms of, I mentioned earlier, a lot of services have gone online. For young people who are LGBTQ plus, it's not always safe or doable. Many people have had to move back home with family or carers, and it's not always a safe space. It's not always a confidential space that you can just kind of talk openly and freely.
See, Evie?
And yeah, again, that's being forgotten, I think, by a lot of professionals. So I think if you look in the world today as well, it's kind of not just the pandemic that is a big concern and worry, although of course that's impacting our lives so much. I think if you look in the news, there's also things like funding to PrEP has been cut, and there's everything going on with the Gender Recognition Act that's causing a lot of distress and worry about young LGBTQ plus people's future and access to healthcare. It's kind of, yeah, there's a lot of things going on in the world that are quite scary, and again, that support just isn't there. I think we already know that discrimination exists within healthcare, and it's quite difficult for LGBTQ plus people to find suitable and feel safe in treatment, and that has only increased with COVID. In fact, we can see that statistics around hate crime have increased over the last few months, and it's a big concern, because if you don't feel safe enough to access medical help, then I mean, yeah, obviously it's not a great situation to be in. But again, I haven't really been seeing that addressed at all. It's kind of like it's just been pushed to the back again. I think going forward, there's definitely a need for LGBTQ plus specific care, and I think it's definitely a community that we need to think about more, especially young people who kind of maybe living at home or rely on services as a safe space. That kind of safe space and constant support and community has been lost. So I think overall, from what I've seen from the pandemic, a lot of issues that have already existed have just been highlighted, like waiting times to access treatment and care for young people is already quite unbelievable, and appointments have just kind of been pushed back or cancelled. And I think no one really knows what it will look like going forward, but we can imagine if the waiting times for mental health support are difficult before COVID, we can kind of imagine how they're going to be after. So I think young people have had some very specific struggles, but I think it is I hope that this kind of pandemic kind of highlights some of the issues that already exist, and we can start thinking about how we can support young people more going forward.
Thank you very, very much, Evie. I thought that was a very well put, articulate summary of issues, and the loss of local services, whether they're council funded or voluntary sector funded, was extremely well made, amongst other points. So many thanks for that. We'll come back to those issues. We won't lose them. But what we're going to do now is sort of step back and take a different end of the lens and to look at some more national, broader trends that we see picking up, that we've been monitoring at the Health Foundation. And so I'll hand over now to Tim Elwell-Sutton. Tim.
Thank you, Jennifer. So I suppose I want to start actually by saying thank you to Evie and all the other young people who took part in the video which you saw, because I think it's so important that as we talk about the pandemic and analyze it, which is what we spend a lot of time doing at the Health Foundation, that we realize how the impact it's having on real people's lives. And what I want to do over the next 10 minutes or so is really try to give you some kind of framework to think about what the broader implications for the pandemic are on the nation's health and health inequalities. If we move on to the next slide, I'm just going to give you a little bit of background here, which I hope will be useful to think with. Now, I don't have time in the next 10 minutes to go through all the evidence that we've been collating and the updates that we've been doing, but hopefully this will just give you some kind of baseline which others will be building on. So if we go on to the next slide, this is how I've come to start thinking about some of the big issues for the nation's health. It's not a very pretty diagram, but I hope it makes some kind of sense, and I'm just going to talk through it. So starting on the left-hand side, there are these two huge forces which we hear in the news every day and which we're all very aware of. The first is COVID-19. So we have this pandemic wreaking havoc really across the world. And that's having a huge impact on people's health, but also on our societies and our economies. But almost equally strong as a force in all of this is the way that we've had to respond to it as a society, and the measures governments have had to take to respond to the pandemic. So, huge shutdowns of large parts of the economy, and restrictions on very basic things that we do, the shutdown of education institutions. These in themselves have had a huge impact on people's health, and we've just heard from Evie about how service disruption has had a real impact on young people. But those two sort of pink circles that I've put there are to remind us that we don't all start from the same place in how we experience the pandemic or the response to it. So first of all, it's really important that we take into account where people start in terms of their health and the health inequalities which have existed for a long time in this country. So we know that prior to the pandemic, there was already a huge gap in health between more and less deprived communities, and between more marginalized communities and others. So we all start from a different place. So that filters how we've experienced the pandemic. And related to that are people's personal, social, economic circumstances. We know that your ethnicity can affect how you've experienced the pandemic. We know that the kind of family you live in, the kind of housing you live in, the kind of job you have has made a huge difference to the impact that the pandemic has had on you. So there are, coming to the middle of the diagram, we know that there are direct health impacts of COVID-19. Some people are more exposed to it than others. Some people are more at risk if they do catch it. We know that it's having direct mental health harm. We know that it's directly affecting health services. But Mike will talk more about this, the bottom box here, the economic impact has been absolutely enormous and will be with us for a long time. And we know that people's economic circumstances are very strong drivers of health. So even once we get to a state where COVID-19 as a virus is no longer an issue, the social and economic impact that the pandemic has had will be with us for a very long time, and will feed into future health and health inequalities. So if we move on to the next slide now, I'll talk a little bit about some of the data, what it's telling us about the impact of the pandemic on health. Or rather, I'm going to start by saying what we knew before the pandemic happened. So the next slide just shows you trends in life expectancy, going back to 1980 there. And actually, you could extend those lines back another 50 years or so to, and you'd see a similar slope actually. But we know that even before the pandemic, there'd been a marked slowdown in improvements in life expectancy. And that was seen across many developed countries, actually, or high income countries. But it's been particularly fast and particularly sharp in the UK and the United States. And there's a mortality report that we published last year on that. So that's kind of the starting point for how the nation's health was progressing. And it wasn't a particularly rosy picture. It was a story of diminishing returns, really. On the next slide, you'll see that there were also huge health inequalities before we started this pandemic. So rather than looking at life expectancy in this slide, I'm looking at healthy life expectancy, the period people can expect to live in good health. And if you compare the most deprived 10% to the least deprived 10%, you can see there's more than an 18-year gap in that. And actually that gap has widened slightly in recent years. When you look at life expectancy on its own, it's widened even more. So we have huge entrenched inequalities, which were actually going in the wrong direction before the pandemic started. If we move on to the next slide. I'll talk now just a little bit. There's so much research and data coming out that I really can't do justice to it, but I'll just say a few points about some of the early findings we have on the impact that this has had on health. So the next slide just shows you, this is the impact that it's had on mortality in the UK. And we think this measure that we've used here of excess deaths is probably the fairest way of comparing things between areas and countries. So this is the percentage of mortality for any sort, people dying from any cause, not just COVID. This year is the red line compared to that baseline, which is an average for the last 5 years. And you can see that, at the peak of the pandemic back in April, we were more than 100% higher in mortality than in an average year. The next slide just compares this to other countries, and you can see that the UK doesn't really come out well compared to any of them other than Spain, which had a higher peak at an earlier stage. So this has been an absolutely huge event for the nation's health, just looking at this very crude measure of mortality. Now, a lot of these deaths are due to COVID, but many of them we know are not currently attributed to COVID, and there's more work to be done to understand what's causing them. Some of it may be disruption to health services or the mental health impacts of the pandemic, but we don't fully know yet. On the next slide, I'll just tell you that, as I said, we haven't all experienced this pandemic equally, and who you are and where you started from makes a huge difference. So this is data from ONS. Looking at the risk of dying from COVID for different ethnic groups. And this is slightly dated now, but it shows you can see a hugely higher risk, particularly for Black people, for Bangladeshi and Pakistani groups, many times more likely to die from COVID. Again, I think there's more work to be done to fully understand that, but we do know that it reflects some pre-existing health inequalities as well. So it's not just that this has had a huge impact on the nation's health, but it's had a differential impact depending on who you are. The next slide again talks about mental health, and this is showing risk of having poor mental health across the gradient of income in this country. So you can see that the least deprived groups on the left there, the most deprived groups on the left there are more likely to poor mental health. But also this compares those whose financial situation has got much worse during the pandemic with those who haven't. And I'm sure Mike will say more about this, but we know that people who are in certain kinds of jobs have suffered more. We know that young people particularly have been really badly hit economically by the effect of the pandemic. And we can see here that that seems to have had a huge impact on people's mental health. So I suppose the interaction between people's economic and social circumstances and their health has just never been clearer, and it's never been more urgent for us to address that, really. Moving on to the next slide. I'll just say a bit about some of the work that the Health Foundation is planning to do in this space. So I've given you a bit of a sort of theoretical framework for how we're thinking about it. I told you a little bit about early findings, but there really is much more to do on this to understand the long-term implications, or the medium to long-term implications of COVID for the nation's health and health inequalities. So if we move on to the next slide, this sort of diagram is going to form the basis for an inquiry which we're setting up currently, and which will launch later in September. And it will be asking these sorts of questions that arise from this. How has the pandemic affected people based on where they started before it hit, and how will that affect long-term health for the nation? So I'll just give you a few details on that, because I think it will be of interest to people. On the next slide, as I say, that inquiry is going to be chaired by Claire Moriarty, who has been a very senior civil servant, permanent secretary in a number of civil service departments. And around her, there's going to be a really stellar advisory panel. We've got Michael Marmot, who's agreed to be part of it, Sarah Davidson from the Carnegie Trust, Lord Victor Adebowale is going to take part, and Professor James Nasru, who's a real expert in ethnicity and health. So we're gathering some really great talent to help us fill out the picture that you saw on that previous slide. We'll be launching it in September, aiming to report in summer next year. We think this is important to do quickly. This isn't the going to be the sort of final word on the pandemic, but we think it will highlight really important areas for government to consider and for society to consider. So we'll be trying to do a comprehensive synthesis of the evidence that's available on how people's experience of the pandemic was influenced by their health and existing health inequalities, and also the likely impact of actions taken in response to the pandemic on people's health and health inequalities. If you want to stay in touch with that, do sign up on our website, and we'll be delighted to keep you up to speed with it. But we feel it's a really important time to start the process of looking not just at what's happening to COVID patients, but what's happening to the nation's health, and who in particular will need to be supported as we go forward. And I'll finish there. Thank you.
Thank you very much, Tim, and very excited about the inquiry. Clearly, a lot of work to be done to gather together short-term pieces of evidence, which really the inquiry will be doing. And that's very important to try and work out what the best solutions are as we go through time in the short term. But also, as Tim says, the long-term impact on health, the fabric of health of the nation as a result of COVID is something that really ought to be tracked, probably through longitudinal studies by large research funders. I'm sure that will happen. But I think that's the other big task, to make sure that those studies are set up well now, so that we have a hope of understanding more fully what the long-term impact is and what can be done. So thank you very much, Tim. We'll turn back to you in the question, I'm sure, Q&A section. So I'm now going to turn to Muna, who is a Director of Public Health up in Salford. And Salford and Muna have been doing very interesting work locally on understanding the impact on communities up in Salford, particularly Black and minority ethnic groups. So Muna, over to you.
Thank you, Jennifer. So I want to talk about the impact of the pandemic on local communities. And of course, the virus has affected us all in different ways. COVID-19 has affected our health, our economy, work, school, and our social lives. But there are some groups that have been affected more than others, either because they have more exposure to the virus or because they are more likely to get the severe impacts of the illness. As well as acknowledging the inequalities and systemic barriers, at the end of my talk, I wanted to present some examples of practical ways in which we can act to protect people's health and tackle some of the inequalities. In Greater Manchester, we're working together as Directors of Public Health with Public Health England and the Association of Directors of Public Health. But mostly, I will focus on what we have seen in Salford. So in the next slide, I'll present some of the information that we have seen and what we've learned about the virus so far. In Salford, the outbreak started really early in the pandemic, and at the time, it affected our care homes. It affected our care homes the most. So here you can see how the number of cases multiplied from the end of March to the middle of April. Before we were able to manage the outbreaks by the middle of May. Sadly, there were many deaths in those first weeks, and the virus had already taken hold and been transmitted 2 weeks earlier before we saw the first cases. As you know, the incubation period is 2 weeks. We were tracking the outbreak by the numbers of people who tested positive, those who needed to go into hospital, and those who needed intensive care. And sadly, of course, we were also recording deaths. In the next slide, you can see that there was a time in April and May when we had 23 ongoing outbreaks at the same time in our care homes. And you can see the corresponding numbers of deaths. Today, we are still seeing outbreaks, but these are smaller clusters of people in the community. As the virus is now circulating in our communities, we're seeing household and social transmission as the national lockdown has been eased. We have a system of test, trace, and isolate that's now in place. So now we are tracking individual cases and their contacts much earlier, unlike the first days when we were only tracking the cases. Because of this, we can fine-tune our restrictions from a national lockdown down to particular individuals and settings, for example, where we have the local restrictions now in many areas of the north. The next slide. At first, we thought COVID-19 was indiscriminate. So in the next slide, we thought that COVID-19 would affect us all because none of us are immune. Now it's clear that some people are at higher risk because they are more likely to be exposed to the virus or because they are more likely to get the severe impacts. In the next slide, I've put it up a quote. So the virus has shown up and exacerbated many existing inequalities in health and our protected characteristics. Some of these are related to the wider determinants like poverty or housing. Others are related to age and ethnicity that you cannot change. So each of the local areas will be seeing a different picture at different times, depending on the makeup of the population and also depending on where the virus is circulating now. In Salford, because a disproportionate number of those affected were in our care homes, then in the first phase of the pandemic, we were seeing the impact on elderly residents and on our health and social care workers. Salford has a population of 14% Black and ethnic minority. Looking back each week, we find different proportions of people testing positive from Black and ethnic minority backgrounds. Sometimes 20% or sometimes up to 50% are from these ethnic minority groups. These are large fluctuations, but mostly because these are small numbers. And of course, we know that we've got incomplete recording of ethnicity. It also depends on where the virus is circulating now the most. So we are seeing clusters in young people now, teenagers, parents, and professionals under the age of 40. Public Health England has looked at some of the disparities that affect the Black and ethnic minority groups. And these disparities can be explained by a number of different preventable factors, like Black and ethnic minority groups have higher rates of health conditions like diabetes, high blood pressure, and heart disease. There are, of course, the pre-existing inequalities that Tim mentioned around geographic and socioeconomic disadvantage. And other factors like overcrowding, large families, occupation, and the very large number of staff who work in the frontline services are Black or ethnic minority. They may also be smoking and they may also have high blood pressure. So if I can just bring the slide just before this one, because it outlines, yes, thank you. So this outlines some of the different factors that the impacts have been universal on everyone, but they've been exacerbated by individuals from Black and ethnic minority groups. So for example, the socioeconomic impact on people who live in the most disadvantaged areas, the impact on low-paid frontline workers, on the elderly who need to self-isolate or shield. Nationally, it seems that the men seem to have a higher mortality, but we haven't seen this in Salford because our outbreaks in care homes affected women. Women tend to live longer and overrepresented in care home residents. But also women take part in caring roles, so also may be represented within health and care workers. Language is a barrier. where speakers of other languages may miss information about the support that may be available to them or even what to do. Faith is another dimension closely linked to ethnicity, and we see this in the way people pray individually or in congregation, and in the way that excess deaths are managed. In Greater Manchester, we produced multi-faith guidance for funerals to mitigate this disproportionate impact. Some religious communities have not been able to celebrate in the usual way, and alarmingly, there are some community cohesion concerns like hate crime and stigmatization. The next slide. So in this slide, the factors that are presented to you as preventable give us the best place to start, because it's from these pathways and factors that we can find ways to mitigate and reduce the level of risk that BAME individuals and communities face. In the next slide. So in June, during lockdown, we were trying to find ways to protect the multiple risks experienced by individuals who are in the front line, whether they're working in health and care or working in other frontline roles like taxi drivers and security guards. So we used this guidance that was applied first in the NHS, and we applied it across all frontline services. Within this guidance, we highlight the importance of individual risk assessments. So there is a workplace assessment, of course, that looks at social distancing, hand hygiene, and personal protective equipment where they are needed. But we also have different job roles and workforce assessments that look, for example, in a school, the cleaners, the caterers, the teachers, and the office staff have separate arrangements that are related to their role. So we have classroom bubbles for teachers and children, we have glass screens for office staff, caterers and cleaners are wearing their usual personal protective equipment with additional precautions for COVID. So the individual risk assessment then looks at some of these factors that we cannot change, but we still need to take into account, like age, ethnicity, and gender. It also looks at health conditions and lifestyles that we can and that we are able to manage. So individuals who are clinically vulnerable because they have a condition like high blood pressure or heart disease, or are pregnant or have diabetes, are clinically vulnerable and at high risk. We aggregate the multiple risk factors to arrive at an agreed position whether the individual is at low, moderate, or at significant risk. So just as an example, an older white person with heart disease who smokes can be at significant risk to the virus, and their BAME colleague who does not have a health condition may be at lower risk. So this means that we are protecting everyone equally, and we advise people at significant risk to be redeployed to work roles that don't bring them into contact with COVID, for example, work from home. And also we recommend that they approach and they take up the offer from their GPs for a long-term condition and the offer of a free health check. So as the risk assessment is by mutual agreement between a staff member and their manager or employer, this gives both of them a chance to discuss concerns like travel to work or having someone at home who is clinically extremely vulnerable, the category we previously used to call the shielded category. So by offering these risk assessments to everyone in the front line, it allows us to weigh up the different ethnicities, ages, health conditions, and lifestyles, and control measures that we can put in place for an individual to look after themselves. For example, that they are complying with the risk assessment for the setting, that they're not coming in when they're unwell, but also that we're offering them a free health check. We've offered in Salford free COVID risk health checks to all our frontline workers, and we're sort of offering this out to all frontline workers, and even either through their managers and through the unions, trying to make sure that they are able to access these checks. So in the next slide. So now we've come out of lockdown, the emphasis has shifted from frontline key workers to local communities who similarly experience the risks. The barriers of faith, language, gender, ethnicity, they still face those same barriers. And so we've been looking at how to engage with our local communities in a way that protects them and use resources that are available in many languages and across countries. As a pandemic, there are professionals around the world developing useful resources that are culturally acceptable and fit for purpose for some of our communities in the UK. So I've given here an example from the World Health Organization for culturally appropriate messaging on face coverings. That's available in different languages, but it's also a sustainable prevention solution because it recommends reusable cloth face coverings rather than a medical mask. And the World Health Organization this week have launched their #WearAmask challenge. So in the next slide, we have to look forward then into the next 2 years. In Salford, we started to plan how we live with COVID-19, especially as it's reasonable to assume we'll be living with the virus for the next 12 to 18 months. The next slide shows the three bubbles in which we're considering that. So we continue to manage outbreaks. That is our health protection role. We're looking at the more recent clusters where we've seen in communities, they've been either in ethnic groups or in social circles. The other thing that we're looking to do is that some of the restrictions have been brought in to try to curtail and balance our freedoms against bringing up the economy and trying to reduce the social and household interactions that lead to outbreaks. So in Greater Manchester, we've got, and areas of the north, we've got local restrictions in which we're trying to halve the entirety of social and household interactions, because if we can do that, we can counteract some of the breaches that are taking place elsewhere. And then looking forward in the next 2 years to tackle health inequalities, there are some priorities that Salford felt was important even before COVID. We'd already planned work on child poverty, mental health, isolation amongst older people, and climate change. So in bringing these back, these priorities are even more important, and now is the time to act. So it's important to think of this work as universal to protect everyone, but also to mitigate the disproportionate impact on Black and ethnic minority groups and on other groups. So I'm sharing this particular slide now with you to show the different stages of an outbreak and the different measures in place where we are balancing restrictions on social distancing, restrictions on household interactions, and being able to balance the level of transmission. It is a balance, and we are feeling our way cautiously. In the next slide. So the World Health Organization call to action is that we must do it all. But we don't have all the answers. What we do know is that we can only do this together, and that now is the time to act. Thank you.
Thank you very much, Muna. Very, very interesting to hear the very detailed approach taken in Salford to address particularly and support local communities that may be incredibly diverse across the area. Extremely interesting to hear that. And as you were talking, I was just mindful of some of the work that some of my colleagues did earlier on this year, looking at what's happened to the public health grant in local authorities over the last few years. In fact, since the financial crash, because, and not just public health departments, but also to local authorities that are doing such important local work, has been more fully recognised, certainly by Test and Trace. So perhaps that's a good segue, I think, to look more broadly at the economic situation that coronavirus is producing and how it's affected the fabric also of local government, which I know Mike will be addressing some of that, and we can also pick some of that up in the Q&A also. So Mike, over to you. Thank you, Muna. Over to you, Mike.
Thank you very much, Jennifer. I just wanted to talk a little bit about what we know about the impact of coronavirus so far on the UK economy and what we at Resolution Foundation would like to see the government doing throughout the rest of this year. So we have the next slide, please. I think what is very special about this recession, about this crisis, that it is very differentiated by sector. And that's driven by the initial lockdown rules and then the need for businesses now to operate under social distancing. So perhaps if we focus on the right-hand side of this chart, it shows what percentage of jobs in different sectors have been furloughed at some point during the initial hard lockdown phase. Now, of course, this was the worst period of the lockdown, where the most severe restrictions on economic activity, but it shows that some sectors have been hit far more than others. So accommodation and food services, arts and recreation and construction being the worst hit initially. And as we know, accommodation and food services, that's hospitality services generally, do employ a very large fraction of young people. I have to go to the next slide, please. This is also a recession, a crisis that's hit all areas of the country, although some worse than others. So on the vertical axis, I'm showing how the claimant count measure, that's the number of people receiving unemployment-like benefits, how that's changed since March. And that's plotted against, on the horizontal axis, what the level was before we went into this crisis. And the fact that the line of best fit slopes upwards from left to right shows you that the areas that were the most deprived coming into the crisis have been initially the worst affected. You can see Blackpool on the far right of your screen. There is an exception though, and that's Greater London. So there's a kind of cluster of cases which have seen particularly high increases in the claimant count measure of unemployment, but actually weren't that deprived to start with. That's mostly Greater London, although we can see Luton appearing there as well. And that seems to be areas where a lot of workers are providing services that for commuters and for office workers. And obviously, as our big cities have become emptied of commuters, there is a lot less work for those people in that service sector helping commuters to do. If we go on to the next slide, please. Just going to talk about the results of various studies which have shown which sort of workers have been affected more than others. The depressing thing, as the headline of this slide shows, is that the labour market hit has acted in a way to reinforce existing inequalities. We know from countless studies that young workers are more affected than middle-aged workers. Indeed, the official data on who has been put onto the furlough scheme shows that more than half of 18-year-olds who were in formal employment back in March have been put on furlough at some point. And it's over a third of all workers under 24. We know low earners have been more affected than high earners. BAME workers have been more affected than white British workers. Those on 0 hours or other flexible and atypical contracts are more affected than salaried workers. Although it's actually not the case that women have been affected more than men, although women are certainly suffering more than men in general from this recession. So this pattern of which workers have been hit, it does of course reflect partly who works in those hardest hit sectors of hospitality and retail, but it also reflects that it is those with the least labour market power who always suffer most during downturns. We go on to the next slide, please. Thank you. So then a rather complicated slide. So let's think about what we're trying to do in this slide and in some recent work by Resolution Foundation is think about what does that mean for household income. Now, the previous slide told you that low earners are more affected than high earners, and that's sort of borne out on the left-hand part of this panel. So on the left-hand part of this panel, we're showing of those people who were in work before the crisis hit, how likely were you to have lost your job, reduced your hours, been put on furlough, or received self-employment, and we're sorting you by where you are on the household income distribution. And it is true that of those who were in work before the crisis hit, you are more likely to be affected if you are in a low-income household than a high-income household. But it's not the case that, there are some people of working age, amongst the working age population, who don't work. And they are, of course, more likely found in low-income households. So we switch to the right-hand side of this chart, and here we're looking at the proportion of all adults of working age, whether or not they work, and just looking at what fraction have been affected by the labour market shock. And it's actually a bit lower for the lowest income households, as I said, largely because they do tend to contain people who are not in the labour market, who are not working, so not directly affected by the labour market shock. But still, there's no way I'm going to argue that this was a top-heavy recession. As I said, this is a crisis, a shock, which is exacerbating existing inequalities. Go to the next slide, please. We had a go in a report last month at trying to say what do we think this crisis done to a distribution of income, to household incomes overall. Our estimate was that back in May, we thought that household incomes on average were 5% lower than they were in the previous financial year. That's an unprecedented year-on-year change. That'll be the biggest, if that pattern continues the rest of this year, that will be the largest year-on-year change. The yellow line is trying to show how that pattern varies across the income distribution. And actually, there is a bit of good news here now, because one of the things the government did when the crisis first hit was to increase universal credit and other benefits and local housing allowance. That's costing it about £9 billion this year, we think. And actually, for some families who are not affected by the labour market hit, either because they've got, or maybe they're key workers, they have secure jobs, or they're not working, for some families at the bottom of the income distribution, that actually means their incomes have gone up. And you can see that in the yellow line towards the left. Had it not been for that benefit increase, we would have seen that the pattern of income change is shown by the blue line, with low-income households massively more affected than high-income households. But as it was, the government did step in, and one of its measures has been crucial at supporting, or at least preventing some of the worst falls at the bottom of the income distribution. Next slide, please. So alongside the benefit increase, the other measure that has been crucial in protecting living standards has been the job retention scheme, which allowing employers to put their employees onto furlough. People keep saying there are 9 million people supported by this scheme. It's a lot fewer than 9 million people, because some people who were furloughed have gone back to work, but it probably at the moment it's supporting somewhere between 3 and 6 million workers. That has been an absolute godsend and has prevented a major living standards disaster. But we know now that it is now the case that their scheme is being phased out. So it's already the case in August that employers are having to make some contribution to their employees' wages, and that will increase through the next 4 months, and the scheme is due to stop in October. And when we think about what will happen to living standards over the next few months, of course, it depends upon how the virus goes and whether we have more local lockdowns. But really, what is absolutely crucial for these 4 million workers or so is how will employers respond as the job retention scheme is phased out. We have the next slide, please. The Chancellor in beginning of July announced some measures, the cut in VAT, the Eat Out to Help Out, the Kickstarter scheme. But at Resolution Foundation, we don't think that's enough, and we still think we risk a major unemployment and living standards crisis. So we've called for the government to do several things. The first of those is we really would like to see much more reflection that this crisis is sector specific. There are some sectors, well, indeed we saw this in the GDP data that came out today. Some sectors have been entirely unaffected by this crisis. Some sectors have even seen a boom in this crisis. But whereas others have been absolutely devastated by the lockdown and by the difficulty of operating under social distancing. And we think that those sectors need more targeted help to get them through the next couple of years. And of course, indeed, as I said earlier, these are sectors which are very important in employing young people. Now, we would like the job retention scheme to turn into something called the job protection scheme, where it provides a wage subsidy to those employers who can still hire people. We would love to have seen the Chancellor announce cuts in national insurance and a VAT cut, which he did do. Now, although he hasn't done it yet, it's our view that it's not too late. We're not out of this crisis yet, so we'll be looking to the autumn budget for the Chancellor to do some of these things. We need to see, as well as protecting those sectors which are in difficulties, if we're going to mop up the large pool of unemployed people, we need to help employers and other sectors to hire more. One of the things that employers always do in times of uncertainty is they get cautious, and they tend to hire fewer people. So we would love to see a national insurance cut for those employers who can expand at this time. Thirdly, we definitely need to focus our attention on preventing the economic shock turning into a long-term unemployment problem. And so for those people who are unemployed, they're going to need intensive help with job search through the Department for Work and Pensions, and we're going to need new programs to help long-term unemployment. And of course, we saw the Kickstarter scheme. That's going to be providing real jobs soon. What's not yet clear is whether what the government's announced has yet been enough. And I know some of the young people in the video were sceptical that is enough. And if it's not enough, then what else could the government do? Well, it's got to provide more direct job creation. Now, we suggested 2 areas which we thought were labour intensive and geographically dispersed, and where there's a social need for new jobs. So we thought that investment in social care and in environmental retrofitting might provide the sort of at-scale job creation scheme that the government could turn to if it wanted to. It's not done so yet. And then absolutely crucial for the autumn budget, and given that slide I showed you earlier, is we don't want to see the temporary one-off £20 a week rise in universal credit. It's only been confirmed for this financial year. We can't afford to see that fall back in April 2021, because there's absolutely no way that the living standards crisis will be solved by then. And that's all I wanted to say. I had one more slide on my sources, but I think we can skip over that quickly and go back to Jennifer.
Thank you very much, Mike. Very nice to end with some solutions that you're putting forwards. Good, thank you so much. So now we have some time. We have about 15 plus 2, 17 minutes for some Q&A. And thank you for those of you who have put forward some questions for our expert panel here. I'll turn to maybe the first question, which was a very specific one, and it's for Evie, based on your comments, Evie. And the question is, what support would you like to see specifically for young LGBTQ plus people in the initial stages of recovery over the next 6 months?
Thank you. So again, I'm not going to pretend to have all the answers, but I think, as I mentioned earlier, a key issue with the lack of support is that nothing has really been proposed or put into place. For example, I'm aware in Bristol, which is where I am, there's a lot of kind of response teams being put in place and thoughts around how we can support specific minority groups that have been impacted. And there hasn't been any suggestions or support put into place for LGBTQ plus people. So I think a really basic term, remembering that young LGBTQ plus people exist and that we do need that bit of extra support. So yeah, obviously it's going to be specific to the area, what your area can provide, but just ensuring that they're being included in the conversation, and that yeah, specific, just remembering to ensure that whatever plans and support is being put into place does specifically include young LGBTQ plus people.
Yes, thank you. I mean, I think well said, and I think what we're seeing obviously is just like COVID is affecting the fabric of the already existing health fabric of the population, so COVID is also affecting the financial fabric of both charities and also local councils, who many of whom provide support for LGBT plus groups, plus other vulnerable groups. So perhaps I can now then turn to Muna and Mike to ask them a little bit more about this. Muna, you're in Salford, and clearly public health has been cut across all local authorities. How might local authorities, firstly, obviously there's a spending review coming up, so clearly more funds are going to be petitioned for, quite rightly. But how might local authorities, how are they learning from one another about how to mitigate some of the effects on vulnerable groups of the type that perhaps you've been doing in Salford? How is the sort of learning system panning out? And is that effective? Or really, are we talking about learning will be a drop in the ocean compared to what's really needed, which is some hard cash in the autumn?
Thank you, Jennifer. So, of course, we do need the hard cash, definitely, because of the years of austerity have had an impact on funding, not just for public health, but also for local councils who are really well placed to understand and to meet the needs of our local population. So, one of the things that we have learned is to work really well together and to use each other's assets, and particularly in our communities, which are really vibrant. We've got a strong voluntary community sector who can help us reach out into those communities. So not just necessarily service users, that sort of people who are disadvantaged or who need assistance with care or who need assistance with housing, but also groups who might not come forward for the support that's available. So it has been about working together within the council. It has been about working together with our voluntary community sector, but also working together with groups of councils, the way Greater Manchester or Cheshire and Merseyside or Greater London are all working together, because many of our communities don't fit within the boundaries and we share some of the same issues and concerns. So we try to have some consistency, particularly with COVID, around the guidance that we're putting out right across the Northwest. So it is a way of making sure that we are using our resources, our staff, our money, and our people, really, our communities, to the best, and using them as assets. That's been our approach from the start. But like you said in the beginning, the hard cash is really important because austerity had meant that there are fewer of us who are able to actually tackle and deal with the rooted inequalities in our societies.
Thank you. And just one very quick last question. You're situated in Greater Manchester, with obviously there's some degree of devolution to the region. You've got a GM mayor. You also have a Salford mayor. Has that system helped in this pandemic? And thinking about other areas of the country that may be facing devolution in future or may be interested in it.
So absolutely, we work together really well across Greater Manchester, but also with colleagues across the whole of the Northwest. And devolution has meant that we're able to take some of those decisions quite rapidly, particularly within the pandemic, such as making sure we've got the personal protective equipment stock in place, making sure that we've got the test and trace in place. So being able to be agile, both politically and at an officer level in our local authorities and the way we work together has been really helpful. So politically, sort of the mayors are working together right across the Northwest, but also the leaders of the individual councils, the officers in charge, chief executives and directors of public health. So all of us are making the best use of time, staffing, and evidence.
Right, thank you so much. And Mike, really the government has promised in its manifesto before the last election that there will be more devolution in England, and clearly we're waiting a white paper. In the absence of that, we've got local economic growth strategies across as part of the industrial strategy across local government. You've given a very nice list of things that national government can do, but I wondered how far Resolution Foundation will focus or is focusing on the kinds of things that local authorities might do within the freedoms that they already have.
Embarrassingly, perhaps not that much is the answer to that direct question, but it's absolutely the case that although I said this crisis is impacting all areas of the country, it is not at all affecting all areas equally. I showed you the facts for Outer London earlier on, but it's obviously also going to be affecting areas highly dependent on tourism differently from those otherwise. So it will absolutely be the case that the right response to promote safe economic activity will be different across local authorities and across areas of the country.
Yeah, I mean, it's very interesting to know, I think, whether or not COVID will actually boost the devolution agenda as national government realises that the levers that it thought it could pull actually don't have as much impact as they had thought. And certainly with test and trace, that's one example, but also to local lockdown and trying to kickstart the local economy. So I think it's quite an interesting question myself. Let me just move on to another question. There's more specific questions, Tim, about the Health Foundation's inquiry. And the question here is, how will the inquiry that you mentioned add value to reports that have already looked at the pandemic's unequal impact, e.g. Public Health England's reviews and the Kevin Fenton report? Who is the inquiry aimed at and who is it aimed to influence?
Yeah, thanks, Jennifer. Well, I suppose the two things that I think will mark out the inquiry that we're running from what's already been done. One is that it will be done starting now. So we're, I think, at a different point from some of the things that have already been done. And I hope that perspective will be really important. I think the other thing, and this is really the most important thing about it, is that for me, the work that's been done so far has looked almost exclusively at the direct impact of the virus on health. So there have been really good reports done so far on who's more likely to catch COVID, who's more likely to die of COVID, and some of the reasons for that. And there are huge inequalities in that. I think what hasn't been done is looking at some of the wider implications of the pandemic and the government response for the nation's health. In public health terms, we describe this as being about the wider determinants of health. We know that some of the strongest drivers of health at population level are the economic conditions people live in, the environmental conditions they experience, and the social conditions they're in. Really, the pandemic has had a massive impact across all of those. And I think what we haven't started to get to grips with yet in a comprehensive way is what that means for health beyond the direct impact of the virus. So I think we're aiming for this to influence government and policymakers at national and local level. I think it should be a really important resource for civil society as well, for third sector organizations and charities who I think will be really important in rebuilding. I think we will be in a different space to what's being done already.
Thank you. And presumably there's also a role for the private corporate sector as well. I mean, not just as employers, but as part of an anchor being in an area.
Yeah, I think that's absolutely right. Yes, and the other sector I didn't mention actually is academia. So I think we will be summing up the evidence which exists, and I think in doing that we'll also highlight areas where more research is needed.
Thank you. There's a question that I really want to give Evie a chance to answer, because I don't know about all of you listening today, but looking at that film, it was very moving, and everybody I think who's in contact with younger people can only just be concerned about the impact that this is having on younger people and their future. That was the big message, the word that was used in that film, wasn't it? What's my future going to look like? How can I take control of that future when all this is going on? So I think, Evie, the question that someone posed in advance was a very important one. Can young people be at the vanguard, be at the forefront, a driving force of strategies to address health inequalities? And if you think that's true, what creative ways could we ensure that young people can be engaged? Not that it's all their problem to solve, as we know. There's an absolute government responsibility, to central and local. But in terms of young people and being active and organised, what do you think they might be able to do differently or more?
Yeah, so I think yes, absolutely, young people can be engaged and, more importantly, want to. I think as you can kind of see from the video that was shown earlier, young people do have an awareness around health inequalities and have some incredible ideas and suggestions about how this can be tackled and what we can do to help. I think professionals often don't realise that we want to be engaged, and that there's lots of us out there who are willing to have these kind of conversations. But I think an important thing to remember is that it's not all young people want to engage in the same way. There's quite often this term that's thrown around is hard to reach young people. And I don't really agree with that term. I don't think there's hard to reach young people. I think it's about finding a different way to reach them. Inviting a young person to a meeting with lots of professionals might be quite intimidating or not something that they want to do. But actually going into the community and listening to those voices who are often excluded and aren't heard is so vital. And I think we will have a lot of work to do, because obviously at the moment directly going into a community isn't safe or possible. So there's ways that we need to learn about how to engage young people more, and kind of what can we do to get around that barrier of technology. And again, I don't have all the answers, but there are lots of young people who would like to have these kind of conversations and are waiting to be engaged.
Thank you. And perhaps Leaders Unlock might help with that, among many others. Unfortunately, we're sort of having to stop there because we're coming to the end of our time now on this webinar. But I hope you agree, all of those who are watching, that there's been some really very, very insightful comments there from everybody who has presented. Also from the questions too, for those of you who posed them, and also the Twitter feed, which I have been low-tech enough not to be able to follow while I've been chairing, which I shall look forward to looking at afterwards. So that really only leaves me to say to thank very much, send my thanks on behalf of all of us here to Evie, to Muna, to Mike and to Tim for joining us today and contributing to a very interesting discussion, giving us food for thought for the next steps. The webinar has been recorded, so it can be available to all of you who have watched on today. It's available on Watch on Demand, and we'll let you know when it's ready to view. And we'll also be looking at some of the most popular questions that we weren't able to get to in this seminar, and try and address them on some frequently asked questions that we'll post as well. Tim mentioned the future inquiry, which he spoke very articulately about, so hopefully you'll stay in touch with us on that and contribute evidence. and help us to really amass in an independent way all the evidence that we have seen and can collect so far for short-term solutions up to a year. And you can sign up to that, more information on that via our website. And as well as that, we'll send you an email after this webinar to let you know more information about it and how to contribute. For those of you who want to have more information about what we do and the grants we give, as well as our research, then there's some information there on that slide. The newsletter you can sign up to, the COVID inquiry, that's the link, and the general get in touch link is that one as shown there. And finally, this is the first in our webinar series, and the next one will be on long-term planning in governments. Why don't they do it well enough? And that's going to happen in the autumn, and we've got some stellar speakers there which will advise you further on. So hope you can join us for that one too. So in the meantime, it leaves me to thank all of you. Hope you, for those of you in the southeast quarter of the country, that you are still unboiled and still in the land of the living. But other than that, thank you very much, and hope you join us next time. Many thanks to everybody concerned. Thank you.